Hey Tigers, it's Britt with Student Health and Counseling Services, and we are back for our last Pay It Forward Friday of this semester to talk about Share the Health. So I think our first Pay It Forward Friday was about Do the Five. So we are back to the CDC to get more accurate and consistent information about how to stay healthy and safe during these times. So if there are still any questions or concerns or things that you're still wondering, I suggest you go to the Centers for Disease Control and Prevention, cdc.gov website to answer anything that may be on your mind about coronavirus. Today we'll go over a few questions just to introduce you to the site, get you familiar with it, and let you know again, this can be a reliable resource to answer anything. They have things here listed on the top of the website about different areas like travel, healthcare professionals, communities, and organizations, that if you click on one of the links, it'll pop up more information about those specific areas to give you a better understanding about how to take care of yourself. Now, but for today, we're just going to go over a few just to see what all the website can have as far as frequently asked questions. Of course, there is so much more for you to explore. Please do so when you get a chance. The first one we'll have is the what is novel coronavirus? So for those that are still wondering or don't really have a clear understanding, the novel coronavirus is basically a new coronavirus that has not been previously identified. The virus causing coronavirus disease of 2019, so COVID-19, is not the same as coronaviruses that commonly circulate among humans and cause those mild illnesses like common cold. Patients with COVID will be evaluated and cared for differently than patients with common coronavirus diagnosis. So for those that are wondering why things have changed so suddenly, why things are so different, it's because it's new, guys, and we need to figure out how to best take care of ourselves and others as we take care of ourselves, still learn about the virus and its effects. So we're kind of doing two things at the same time. That's why we're having to be extra cautious to take care of ourselves and others. So let's check out another one. So with the newness of the coronavirus, it comes with a lot of fear and anxiety, right? There has been some anxieties around what it is, how we are going about our life nowadays, but it's also sort of changing the way we look and see each other. And that's becoming an issue because that contributes to stigma. So let's check out two below. Why might someone blame or avoid individuals or groups create stigma because of COVID-19? And this is a big concern because we're in this together, everyone. So we need to figure out how we make sure we're being mindful of our stigma or biases when it comes to the spread of COVID. So people in the U.S. may be worried or anxious about friends or relatives who are living in or visiting areas where COVID-19 is spreading. Some people are worried about getting the disease from these people. Fear and anxiety can lead to social stigma, for example, toward people who live in certain parts of the world, people who have traveled internationally, people who are in quarantine, or healthcare professionals. Stigma is discrimination against an identifiable group of people, a place, or a nation. Stigma is associated with a lack of knowledge about about how COVID-19 spreads, a need to blame someone, fears about the disease and death, and gossip that spreads rumors and myths. So, y'all, stigma hurts everyone because it creates fear and anger towards regular folks who are just trying to fight the disease just like we are. So the disease has no face. There is no identifiable way that we can point out COVID and tell it to stop. Not even a chance. We need to make sure we are dispelling any stigma that may come about, and how we do that. There's a question on here for COVID to help us too as well. You can fight stigma by providing social support in situations where you notice it's occurring. So if you see it, call it out. Be that person that stands up and advocates for those around you. And stopping stigma is important because it helps us make sure that we know that we are resilient. And again, we're in this fight together. We're not just doing these for the sake of ourselves. We're not staying home for the sake of self. We're staying home for the sake of everyone to make sure we're all safe and taking care of ourselves and those around us at the same time. So make sure you check out these additional resources on mental health and coping during COVID-19 and knowing the facts. Know the facts so that you'll know when you see stigma and you'll know to stop it in its tracks. So let's go down to a couple more. How COVID spreads. Again, just to inform yourself to make sure you're up to date and aware about how things are happening. So how does the virus spread? COVID-19 is spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. Hence, why the PPE, the masks, and the gloves are so important, and where I'm encouraging folks to wear them more often. These droplets can lead into the mouths and noses of people who are nearby or possibly inhaled into the lungs. Spread is more likely when people are in close contact with each other within about 6 feet. So that's where that social distancing piece is coming from, that recommendation for us to stay apart from each other in the home, or even if you're going in public to get groceries or food, again, to be mindful to keep your distance at least 6 feet to make sure you're protecting yourself. And again, people around you, y'all, this is our social contract to make sure we are mindful to take care of each other during these times. Okay, so one more and we will call it a day. And let me see, I'm going down to how to protect yourself. Here we go. How to protect yourself during these times. So the CDC has given us the recommendation of how to protect ourselves. Again, going back to our first Pay It Forward Friday about doing the 5, it's going to be probably the same recommendations from before. So we're going to click on the link. First of all, knowing how it's spread, we just talked about that a little bit, spread from person to person through the air. And we know that everyone should wash your hands often. So making sure you are using hand sanitizer, avoiding touching your eyes, nose, and mouth. Avoid close contact. Remember that 6 feet, so even if you are in a public space, to keep your distance between yourself and other people. Covering your mouth with, covering your mouth and nose with a cloth over your face and when you're around others, or a mask if you have access to one. And finally, coughing or sneezing in tissues or in your elbows if you're able to at the time, and immediately washing your hands or washing the area afterwards. And clean and disinfect frequently. So surfaces in your home, items you're bringing into a home, making sure you're disinfecting and cleaning everything you can. So the CDC, again, is a reliable website on information about coronavirus, how to protect yourself, and how to keep yourself and others around you safe. They have so many more questions that can be asked and answered. Make sure you're keeping yourself up to date and abreast. Remember to be informed, not necessarily overwhelmed. Know enough to take care of yourself, but make sure you're mindful of what is too much, and at one point you need to stop, take a break, and take care of yourself and focus on your own mental health. So again, be informed, not flooded. Okay, so be sure to continue to take care of yourselves. It's almost the end of the semester. We see the finish line. Go for it. You got it. Hopefully, if you need us, we'll be here.